You'll find that there are some description of pharyngeal arches which are always important topic for our entrance preparation. And we get one question here, epiglottis. It's a larynx cartilage. What do you think is the answer? Epiglottis is a cartilage developing in the larynx and is developing from arch number 4. Now, if you say it is arch number 4, you will find pharyngeal arches are actually U-shaped arches and they develop around the pharynx anterolaterally from neural crest cells. If you remember, we have discussed earlier that the pharyngeal arches are around the pharynx U-shaped arches and they develop from the neural crest cell. But be careful, neural crest cells will not form everything in this area. Though most of the connective tissue is from neural crest cell, U-shaped arches, like mandible bone is from neural crest cell, hyoid bone is from neural crest cell, it is U-shaped, but not everything. So you have to know the exception also. But anyway, here we will keep your answer as choice number B. Then what about the other parts of the larynx cartilage where they are developing from? Let us look at the details. In fact, you have to understand that there are some 6 pharyngeal arches. And if you say there are 6 pharyngeal arches, then they will be U-shaped as we are discussing, and we'll take a section also. Let us look at them from the front view as well. Here they are just developing, so you cannot see all the 6 of them, but there will be total 6, and 5th arch becomes rudimentary. The 5th arch is actually rudimentary in humans. Now, as you're talking about these arches, they're developing and there'll be 6, but the 5th arch will become rudimentary. Fine. Let us look at these arches from the front view. See, there's the first arch, this is the second, this is the third, and this is the 4th, and 6th is gone. 5th is gone. So there'll be directly 6th arch. 5th is absent. And the first arch will have 2 processes. There will be upper maxillary, lower mandibular. Upper maxillary, lower mandibular. First arch bones. First arch bones. Okay. You want to see the front view? Yes. This is the upper maxillary portion. This is lower mandibular portion, but this is first arch. If upper maxillary, lower mandibular, first arch, then what is the second? This is second arch here. I'll use the other pen. Second arch, third arch, 4th, and 6th arch from the front view. Now we want to see their derivatives, and it's a very large table which we have to master. So you will be mastering some large table. Yes. What is there in the table? Actually, there is arch number, the nerve which is concerned, and embryonic cartilage, bones developing, and some neural crest cell muscles developing, and then there will be some tongue developing, some arteries developing. Actually, each and every line in this table is important. Why? Because already MCQs and they repeat themselves again and again. So you want to master everything, whatever is given here. Yes, let's do that. You will find the first topic is skeletal elements like mandible bone, hyoid bone you want to discuss, and larynx cartilage also you want to discuss. So see, this is a side view of the baby and you are looking at the first arch. What is the first arch doing? It is actually having Meckel's cartilage and forming the mandible bone. So first arch is Meckel's cartilage forming mandible bone. What is the second arch? It is Rickert's cartilage and forming the hyoid bone. So first arch is called mandibular arch and second arch is called hyoid arch. And then you also have third arch contributing to lower part of hyoid. Third arch contributing to lower part. So second part form upper hyoid, third part will form lower hyoid. And what about the 4th and 6th? 4th and 6th will form the larynx cartilage. 4th and 6th will form larynx cartilage. Let us look at the details now. You see, first arch will form mandible bone. Not only mandible bone, but it will also form the malleus bone and the incus bone, which is in the middle ear cavity. Then who is forming stapes? Actually, stapes will develop in the second arch along with upper part of the hyoid bone. along with lesser horn of the hyoid bone. You are telling in the second arch we have the stapes bone developing? Yes, along with upper body of hyoid and the lesser cornu of the hyoid. Then we'll form the greater cornu. If you say greater cornu, then greater cornu is along with the lower body developing in the third arch. So lower body of the hyoid and the greater cornu will develop in the third arch. Yes. So upper hyoid second arch, lower hyoid third arch. What about the arch number 4, 6? Actually, you have to remember fourth arch is forming not only thyroid cartilage but also, question was there, epiglottis. If you say fourth arch is forming thyroid and epiglottis, then what about the rest of the larynx cartilage? They come from the sixth arch, maybe cricoid or arytenoid or corniculate or cuneiform. They all come from sixth arch. This is the diagram which we are supposed to draw. You want to talk about the larynx cartilage? Yes. How many developing in fourth arch? 2. Name. Thyroid and epiglottis, and rest of them sixth arch. Name. Cricoid, arytenoid, corniculate, cuneiform, whatever in sixth arch. And see, this was side view and this is front view. So they are U shape. So mandible is U shape, hyoid is U shape, thyroid cartilage is U shape. Thyroid cartilage is U shape, you know, like that. Okay, fine. If you say first is Meckel, second is Rickert's, fine. What about the nerves? Nerves. We have to discuss the nerves of the arches also. And as we will talk about the nerves, that will be the next topic. First, you discuss the mandible bone, which is actually developing in first arch. Then you discuss the hyoid bone, upper hyoid in second, lower hyoid in third. Then you discuss the thyroid cartilage in the fourth arch. They are all U shape, U shape. From neural crest cell? Yes. Bones are from neural crest cells. So this is the lesser cornu and upper hyoid? Yes. If you say lesser cornu, upper hyoid, then it is second arch. And what if I say lower body and greater cornu? Then it is third arch. If you say lower body and greater cornu, the third arch of the hyoid. Okay, fine. Let's draw the diagram then, quickly. And what are we looking at? Pharynx front view, because you're talking about pharyngeal arches. So we are looking at pharynx front view. Yes, this is the pharynx front view. What is pharynx? Pharynx, you know, the upper part of the gut tube. If you say pharynx is the upper part of gut tube, I think it is lined by endoderm. Yes, it is lined by endoderm. The gut tube is lined by endoderm. Endoderm will form the epithelium. Endoderm is the first germ layer to develop, which is the next one. Next one is the mesoderm. If mesoderm is the next one, which is the last one to appear, that is the ectoderm. That is the ectoderm. So we're telling this is the ectoderm. Yes. This is the last one to develop. Yes. What is between the ectoderm and endoderm? That is the mesoderm. And what is the mesoderm doing? Mesoderm is forming the pharyngeal arches. You mean to say that pharyngeal arches are developing from the mesoderm and lined by endoderm on the inside? Yes. And ectoderm on the outside? Yes. But pharyngeal arches are from mesoderm? Yeah, they are. Do you know where is this mesoderm from? Because this is head and neck mesoderm. Since this is pharynx, this is head and neck mesoderm. Where is head and neck mesoderm, especially anterior lateral head and neck mesoderm from? Mostly neural crest cells. Now, if you say it is mostly neural crest cells which will contribute to this mesoderm forming the pharyngeal arches. So, pharyngeal arches mostly come from neural crest cell, derived mesoderm, which is secondary mesoderm. Now, if you say this is secondary mesoderm, because it is the neural crest cell forming the secondary mesoderm, it will form most of the pharyngeal arches. It is not entirely secondary mesoderm. There is some primary mesoderm also. If you remember, we have talked about the pharyngeal arch muscles like masseter. The pharyngeal arch muscles like masseter, skeletal muscles, they would have come from paraxial mesoderm, which is primary mesoderm. So you write it down. Tell. We have some mesoderm coming from the primary mesoderm also. If you say there is some primary mesoderm also, what is that? That was para-axial mesoderm. If you remember, it is the para-axial mesoderm which will form all the skeletal muscle, including pharyngeal arch muscles. Example, masseter. So you are mentioning mandible bone is from neural crest cell? Yes. Hyoid bone is from neural crest cell? Yes, but not the muscles. Masseter muscle or any muscles of mastication, the pharyngeal arch muscles are actually developing, any skeletal muscle is developing from paraxial mesoderm. This is primary mesoderm. Okay, can we discuss some bones then coming from neural crest? Yeah, okay, let us see. Some bones which come from neural crest cell. The first one is the mandible bone. Let us draw the mandible bone. So this is the first arch forming a U-shaped bone, which is the mandible bone. Now you say this is the first arch. Yes. And forming the U-shaped bone, mandible bone. What is the second arch and third arch doing? If you're talking about second and third arch, the next bone, who is that? The hyoid. But remember, in the hyoid, there is a upper hyoid and then there is a lower hyoid. If you're telling the lower hyoid, this is the lower body of the hyoid, then it will come from the third arch. But if you're talking about the upper body of the hyoid, then it would have come from second arch. So you're telling that this second arch will form the upper body of hyoid? Yes, U-shaped bone, hyoid bone. Upper body is from second arch. And what is the third arch doing? Third arch is forming the lower body. This is lower body. What else? You know, there is a greater cornea. It will develop in the third arch. If you say greater cornea will develop in the third arch, then where is the lesser cornea developing? Actually, lesser cornea will develop in the second arch here. This is lesser cornea. Sorry, you have to draw it on the hyoid bone here. So you are telling that when we are talking about the, that is the hyoid bone here. So this is the lesser cornea of hyoid bone? Yes. So this is the hyoid bone together? Yes. Actually, upper hyoid and lesser cornea develop in the second arch and lower body of hyoid and greater cornea develop in the third arch. Then what is developing in the fourth and sixth arch? If you say fourth and sixth arch, then tell between fourth and sixth arch, the fifth arch is rudimentary. The fifth arch is rudimentary, it has disappeared. So if the fifth arch is rudimentary and it has disappeared, fine. What is developing in the fourth and sixth arch then? You can show now the front view of the thyroid cartilage. Of the larynx, yes, front view of the thyroid cartilage of larynx. Partly developing in sixth arch, but mostly developing in fourth arch. So you are telling that this is the front view of the thyroid cartilage of the larynx. Some of it is developing in the sixth arch, otherwise mostly in the fourth arch. Yes, thyroid cartilage of larynx, mostly fourth arch, partly sixth arch. I think there is one more bone developing in fourth arch. Yes, that was a lid over the larynx and that is called epiglottis. So this is the lid over larynx called epiglottis developing fourth arch. I think there are two cartilages developing in fourth arch. Yes, they are. In the fourth arch, you have two cartilages developing. One is epiglottis and the other is the thyroid cartilage. Then what is developing in the sixth arch? The lower cartilages. And who is the lower cartilage? That could be cricoid cartilage. Now, if you're talking about the cricoid cartilage or maybe the others, like maybe you're talking about arytenoid cartilage or maybe it is the corniculate cartilage or maybe it is the cuneiform cartilage, whatever cartilages are left now, maybe cricoid or arytenoid or corniculate or cuneiform, whatever, larynx cartilage, all develop in the sixth arch. This is controversial topic. And follow what I am telling you. You'll find different answers in different books. But just remember, if you say fourth arch, there are two cartilages developing. And what are the two cartilages developing in fourth arch? They are epiglottis and most of the thyroid cartilage. And what is developing in sixth arch? Whatever is left. What is left? The cricoid cartilage, arytenoid, corniculate, cuneiform, whatever cartilage of larynx, now in the sixth arch. Just be precise in answering. Then we move further. I have told you, mandible bone will develop from neural crest cell, but not the masseter muscle. Why? Where is masseter muscle from? It is actually a skeletal muscle. Skeletal muscle comes from paraxial mesoderm, which is primary mesoderm. Then what is neural crest cell giving? Secondary mesoderm. If you remember, most of the skull bones are from Most of the skull bones are from neural crest cell, but not the posterior part. Why? What about the posterior part? Where is this posterior part of skull from? Actually, that is primary mesoderm. You mean to say pharyngeal? Yes, you can say pharyngeal, no problem. So you're telling that posteriorly, especially occipital bone, yes, especially occipital bone, but also part of parietal bone. So part of parietal bone and occipital bone, posteriorly, yes, because neural crest cells are anterolateral, anterolateral. So anterolateral only, yes, not posterior, no. Posteriorly it is primary mesoderm, yes. Pharyngeal mesoderm, yes, which will also form muscles, yes. Be careful about the options given by the examiner. There can be subtle differences, and subtle differences change the answer. So be careful. Practice more and more MCQs. Then you will realize the importance of this kind of discussion. Usually faculties will avoid it, but I go into these things because they are the things which give you the rank. They decide your rank. Those complexities decide your rank. Anyway, we are moving into the pharyngeal arch nerves now. You should remember some of the names like you see this diagram. The trigeminal nerve is the nerve of first arch, especially mandibular division. So you're telling that trigeminal nerve has three. Trigeminal three? Yes, actually there is ophthalmic division of trigeminal, maxillary division of trigeminal, but somebody asking you first arch nerve, you should answer mandibular nerve, branch of trigeminal. Then what is the nerve of first, second arch? We already have discussed them under GVE, under SVE column. You remember under SVE column, SVE, special visceral muscle, pharyngeal arch muscle, number 5, number 7. So number 7 is for muscles of facial expression, second arch. So facial nerve for muscles of facial expression, yes. Do you remember now number 9, 10 and the cranial part of 11? So now number 9, 10 and cranial part of 11 making nucleus ambiguous, controlling the muscles of palate, pharynx and larynx, arch number. So now number 9 or maybe now number 10 or now number 11, you will see they are making nucleus ambiguous. They are nerves of arch number 3, 4, 6, making the muscles of palate, pharynx and larynx. We have to precisely discuss them. So we'll do that. But at this moment, just remember, trigeminal nerve may have ophthalmic branch, maxillary branch, but mandibular nerve should be your answer for first arch nerve. What about the second arch? Second arch, facial. And third arch, glossopharyngeal. Glossopharyngeal is the third arch. And what about the fourth and sixth arch? Fourth and sixth arch. You have superior laryngeal nerve, branch of vagus, fourth arch. Recurrent laryngeal nerve, branch of vagus, sixth arch. So you're telling that vagus nerve supply fourth and sixth arch? Yes. If you're talking about fourth arch, it is superior laryngeal nerve. If you're talking about sixth arch, it is recurrent laryngeal nerve. Then what about the accessory nerve? You were telling some accessory nerve also. Yeah, there is a vagus accessory complex which we have to discuss, but we'll discuss later. What is that? Vagus accessory complex. We will discuss later. So what do I do now? Now you just remember superior laryngeal nerve is the nerve of fourth arch. Recurrent laryngeal nerve is the nerve of sixth arch. Both are branches of vagus. Vagus, fourth and sixth arch. Later you will see it is not alone. Vagus is not alone. Fourth and sixth arch, you have actually vagus accessory complex. Later we'll discuss. Okay, what do we discuss now? There is a description of pretraumatic nerve also. What is that? You know, first arch, which nerve is there? Mandibular trigeminal. But it has a pretraumatic nerve also. Who is that? A branch of facial. What's branch of facial? Cauda tympani nerve, branch of facial. You are telling cauda tympani nerve, branch of facial nerve is a pretraumatic nerve for first arch? Yes. Then what is the pretraumatic nerve for second arch? These type of questions are coming. So you remember, if you are telling that mandibular nerve is the nerve of the first arch, it has a pretraumatic nerve also, which is cauda tympani nerve, branch of facial nerve. So you're telling that first arch has the main nerve, which is mandibular nerve, branch of trigeminal? Yes, but it has a pretraumatic nerve also. Why do you need cauda tympani here? That we'll discuss when we discuss the tongue development. Can you tell me which is the nerve of second arch? Of course, facial nerve. But when you say nerve of second arch is facial nerve, can you tell me what is the pre-traumatic nerve for second arch? Yes, it's branch of glossopharyngeal. Which branch of glossopharyngeal are you talking about? Actually, glossopharyngeal nerve will give a branch into second arch, and that is called tympanic branch of glossopharyngeal. So there is some tympanic branch of glossopharyngeal which is going to enter the second arch. Yes, I thought second arch is facial nerve. It is, but when you say second arch is facial nerve, it has a pre-traumatic nerve also, which is a tympanic branch of the glossopharyngeal nerve. And otherwise, what is glossopharyngeal nerve for? Otherwise, glossopharyngeal nerve is the nerve of the third arch. Nerve of third arch. So glossopharyngeal nerve is the nerve of third arch. Otherwise, yes, it is.